I'm Jason Aponte, and I've got a special guest who is going to talk Brock Purdy's injury, timetable, what sort of options that he has. Stick with us. Welcome, everybody. I'm Jason Aponte, and I'm joined by Dr. Nirav Pandya of 95.7 The Game. You guys know him, big Warriors, big Niners fan. Doc, thank you for taking so much time to, talk with me about this and maybe give 49er fans a little bit more insight as to what's going on with Brock Purdy. But before we get into all that, how are you? I know you're traveling. You're in Denver right now. Really gracious of you to give me some of your time today.
No, I'm doing great. It's cold out here in Denver. I mean, it's been cold in the Bay Area, but it's a different kind of cold out here in Denver, so it's hitting me a little differently. But happy to hop on. A lot of Bay Area stuff going on right now. So happy to answer some questions. Yeah,
absolutely. So, you're a Chicago guy though, right? So that how does this Denver cold kind of compare to Chicago?
It's definitely a little bit chillier, the temperature dropped down, but there's not as much wind. So I can handle being outside without the wind, but it's just, I've lost my tolerance. It's just, right. It's been a long time since I lived in Chicago. So.
I literally just got back from the store and it's getting down to 25 degrees. I think it's about 8 degrees tomorrow. So, I mean, just a lot of cold. And I'm kind of itching to get out to Arizona, even if our team didn't make it, unfortunately. So let's just start there real quick.
Yeah.
Before we get into the injuries, just initial thought on the game, how that kind of played out. For me, I kind of went at peace with it when Brock Purdy wasn't able to come back in. You understand that you can't really do much on offense when your quarterback can't throw football. What did you think about the game?
I mean, it's just the most bizarre football game I've watched. I mean, you go in there, first Purdy gets injured, and first of all, the initial reaction is wow, we lost Lance, we lost Garoppolo, now Purdy's out, and maybe Josh Johnson will pull something out. And we're like, it's not going that well, but maybe the defense can hold us into it. And then Johnson goes out. I'm like, what is this team going to do? And then I was like, are they going to do the Wildcat, have someone throw? And it was just really bizarre to see almost a whole half of football where you knew a running play was happening. And I feel just the fan base, both Philly and the 49ers fan base, is just let down from a good game. I think more than anything else is disappointment. And I think people would have debated, if the game was close, Purdy had played. I felt like we would have left with a good impression of what had happened. But just the way things went, I think everyone was robbed, the NFL, from a good game. So it was just really sad.
That's my feeling, honestly. I think NFL fans, even if you reveled in the 49ers misery, and the fans' misery, you still were robbed of a much better game, And again, Eagles fans have nothing to apologize for because if the shoe was on the other foot, 49er fans wouldn't apologize. They're the ones moving on. But, yeah, let's not bury the lead. Brock Purdy's injury. Kyle Shanahan spoke a little bit about a timeline. First of all, before we get into that, and I see we got super chats. If you guys want to send them, I'll just star them and I'll get back to them. I just want to get some quick thoughts from Doc. So the injury itself, talk to me about the injury itself, the torn UCL, and what that is and what that how severe it is and how it entails.
Yeah. So what the UCL is, it's it's short for ulnar collateral ligament. So that's basically a thick band of tissue that's on the inside part of your elbow, kind of right over here. And that really helps to stabilize the elbow. I call it the ACL of the elbow. Without it, it's really hard to do sports activities. And the reason why it's really important in throwing is that when you throw, whether you're a pitcher, you're a quarterback, if you don't have that there, then it becomes very painful and you just can't be effective. Yeah, you can throw. We saw Purdy try to throw one time, but it was not a very powerful throw or potentially, if you throw longer, a very accurate throw. So it's very difficult to do anything sporting related with your arm. Now, what can happen is that when you get a blow to it, which can happen in a football player, then you can get kind of like a clean tear. In pitchers, what ends up happening is that you're throwing for years and years and years, and that tendon starts wearing away. And then finally it just kind of has that last little pop and it kind of goes away. So very different from football players versus baseball players. But at the end of the day, it's something that the elbow needs to be able to throw. Whether you're a pitcher, you're a football player, anyone, tennis player, it's really important to give that stability.
And Kyle Shanahan talked about pitchers, right? Because, when you hear Tommy John surgery, you think pitchers, right? And, I'm much more of a football guy than I am a baseball guy. He talked about being able to locate curveballs more than anything. And there has been a little bit of talk about at times when Tommy John surgery does occur, and I know we're not saying that this is what's going to happen with Brock Purdy, is pitchers actually come back with a little bit more velocity because they've been working on that arm. And it's almost like I'm probably going to date myself like rookie of the year. To Henry Rowan Gardner a little bit. Right, exactly. So that's the interesting part. It was more about being able to locate curveballs more than it is velocity, right? So having said that, Kai Too Nice actually has a super chat, and he's asking a question. If Purdy does repair, will his arm be back to full strength, or will there be limitations? So before we get to that question, I'll ask this. Kyle Shanahan seems to be pretty straightforward with the 6-month timetable, right? Yeah. And when he was asked about Jimmy Garoppolo, I thought his answer with Jimmy Garoppolo kind of reinforced that he really believes that this is a 6-month deal. Yeah. What would a 6-month layoff for him look like? Is that just rehab, or is there a cleanup surgery? And how do you compare that to Nick Mullins?
Yeah, so typically the 6-month rehab is similar to kind of like the Nick Mullins procedure, where essentially when that ligament is torn, the surgeon goes in there, or they're looking on the MRI and they're like, look, this is torn, but everything that's there is really good and we can put it back together, as opposed to pitchers where it's like everything's gone and nothing in here is really, really good. So we got to put something new in there. So when you're able to put that ligament back together, which is quote unquote the repair, typically what happens the first 6 weeks, got a brace, you're kind of just working on building mobility back. Then after 6 weeks, you get your work on strengthening, and you can actually start throwing off a repair right around 3 months if everything's going well. And then at 6 months, as long as everything's lined up, you can actually fully go back to play, somewhere between 6 to 7 months. So it's definitely one of those things where, Shanahan's talking about it, the team's talking about it, and I'm sure Purdy probably wants that, is that you get the surgery done pretty quickly, you can be ready for football camp and playing in a game, similar to the Nick Mullins timeline, right when training camp starts. And that's very different than the full-on Tommy John, where this is a year. You're going 9 to 12 months, and that's the end of the season. So that's where that 6-month timeline comes in, where he can be ready for football activities if he gets down the repair procedure.
And just to clarify for people, repair and reconstruct, those are two different words when it comes to the UCL. Can you explain a little bit further into that?
Yeah, absolutely. And I think that's key, because I think a lot of people kind of are getting those terms kind of messed up. So repair is basically you're not putting anything new inside there. This ligament's torn and you're basically sewing it back together. You may be kind of making it a little bit tighter, and then there's nothing artificial, no other ligament or anything being put in there. That's quicker because you're just basically having stuff heal back together. With a reconstruction, which is the Tommy John surgery, you're actually putting a new ligament in there. So you go in there, this ligament is all torn up. You can't sew it back together. It shreds. So then you're either taking maybe a tendon from another part of the body or taking a cadaver piece of tissue, and you're putting basically a new ligament in there. Because that has to basically heal into the body, that's why you got that 9 to 12 month recovery for that.
Absolutely. So that's great information, guys. And that's why when you hear repair, reconstruction, that's why there's two different timelines. And who better to hear it from than an actual doctor than us Twitter doctors and us who are speculating. So 8 minutes in, almost 100 people in here. Make sure you like this channel, subscribe to the channel, hit that notification bell for when we go live. Make sure you follow Doc on Twitter as well, too. He'll give out his Twitter as well, too. So when we talk about what Kaya here is talking about, if Purdy does repair, will his arm be back to full strength or limitations? I do think he means reconstruction. Again, this is why we're talking about the two terms. Repair would be that 6-month timeline, which he could start throwing the football in 3 months and then be fine in 6 months and have no limitations. But the reconstruction part, talk to me about that.
Yeah, so most of the data from this comes from pitchers, and we look at pitchers who get this surgery done, usually about 9 to 12 months, about 80 to 85% of them fully get back. I mean, like you said, they're either back to the same level or some of them are even better. The one quarterback we have an example who had this done was Jake Delhomme. And he actually said he came back and he had his best season. I think he was comeback player of the year after that. So I think because even in pitchers, very good outcomes. Quarterbacks, they're stressing their arm less. There's less load across it. So barring some sort of bizarre thing about how his arm responds or something else goes on, I think the data would suggest that if he gets the full surgery, he's going to be fine. Even if he gets the repair, even that data suggests he's going to be fine. So I think everything is working in his favor. I think the key thing for all 49ers fans is, what does that mean for the quarterback situation next year? Is Purdy going to be leading the team coming in, or suddenly is he not going to be available until the latter half of the season, and then it's Trey Lance plus or minus someone else? So I think that's really where the key is. Not necessarily will he come back, but when he'll come back.
Let's table that question, because I'm gonna put your feet to the fire and I'm gonna let you make a prediction, based on your medical, expertise and also vibes. But we're very much about vibes here as well too. So I just want to get to this one too. Ruben Quinones, Jason is stupid, Doc is smart, Jason is wrong, Doc is right, Doc's the best, Jason's the worst. Doc's very good looking, Jason's not attractive. Great show, guys. Love hearing from both of you. If you guys don't know, big Happy Gilmore fan, me too as well. So that's exactly what he's getting at right there, man. And he's a big Warriors fan, so he knows all about Doc. But thank you, Ruben, for the funny comment. This guy. But So a little bit more into, so I think we understand kind of what's going on with Brock Purdy and what things can look like on separate timetables. I do think it's important to define these words and define what that means in terms of what he can be going into training camp, right? A lot of stuff that we can still wait for. So I want to ask you this. When you hear that Brock Purdy is exploring options, is there something that he can do or say, I don't want to do this, I want to do this? Or is there something that a medical, expert would say, you have no choice, it has to be this? Like, what does exploring options mean?
Yeah, no, that's a great question. I think when we think of this, like with an ACL tear, you get an MRI, it's torn, you're getting surgery. Like, it's very clear. The thing with UCLs is that when you look at an MRI, you look at an exam, there's so much, every different surgeon is going to have a different opinion. They're like, oh, actually, they may not need surgery. Oh, this needs a repair. Oh, this needs a reconstruction. So you do actually, most people who get UCL surgery will see a couple different docs because there's so much variability in it as opposed to an ACL or a meniscus tear. So probably what he's doing is having multiple different people who do this a lot, look at the MRI, examine them and say, hey, look, maybe you don't need surgery. Maybe you need the repair. Maybe you need, you get the full reconstruction, and kind of taking all those things into consideration. I think at the end of the day, though, it's probably based on what we're seeing and the way he looked. There's probably going to be some sort of surgery. The real question is, do you get the repair or the reconstruction? But even if some surgeon says, hey, look, I think this is going to be a repair for you, it's all going to be based on what they do when they go inside there and open up the elbow. So pretty much all surgeons say, look, I'm going to go inside there. This is my plan. But if it looks worse or better, then I may shift course. So I think he's just getting opinion from everyone. They're looking at his MRI, giving him his thoughts, and then he's going to decide who he feels is the most comfortable in terms of doing this. And the crazy thing with UCLs is that there are probably only 4 or 5 surgeons who really do this in the country on professional athletes.
Wow.
So he's probably making the rounds on people who do this and kind of getting their opinion on it. And there's no rush to do it. You have some time. A week here or there can make a big difference in terms of getting the right person to do it.
Wow, I didn't know that 4 or 5 people in the country that can actually do this surgery. I think that's really important to know. So James Hall says, no, we want to know if you come back from a repair, is it going to be as strong as a reconstruction?
Yeah, that's a great question. And I think that and that's where a lot of the surgeon experience goes into it, because you're absolutely right. If you go in there and you're trying to repair something that looks like it's not going to be very good quality, but you're trying to like force someone back, absolutely, then you could be dealing with the problem down the road. And same sort of thing. If you do a big surgery and didn't really need it, then you're kind of putting someone through extra rehab. So let's assume that all the boxes are checked. It's a repair. It's good quality tissue. Absolutely. You're going to be just as strong because it's your own tissue. I think that's the best thing. The best thing is to have your own tissue heal. So, and also the fact that you can actually rehab more, you can be a little bit more aggressive. So absolutely, I think it's pretty comparable. For baseball pitchers, might be a little bit different story, because there's more stress. But for a quarterback, I think that if you can use your own tissue, you can do the rehab more aggressively, I think you're going to be just as strong.
Great question, James. Absolutely. See, I didn't even think of that one. And Fable wants to know, how long would a partial tear of UCL versus full tear take to heal without surgery?
No, that's another great question. So if you look at partial tears, most of them kind of land right around 6 to 12 weeks, rehab, maybe do some injections, things like that. With full tears, for most throwing athletes, they typically wouldn't, treat it with rehab. Sometimes where you see people treat full tears without surgery is like, say you're a linebacker or someone else who doesn't throw. A lot of those don't need to get fixed because you're not using the arm that way. Typically in that case, and it's kind of the same way, it's like somewhere between 12 to 18 weeks. So I'm thinking, based on kind of what's been reported, obviously none of us know for sure, that it sounds like he's got a significant enough tear where they're probably going down the surgery route. But you never know. He may get another MRI and he says, actually, this doesn't look as bad as we initially thought. Maybe let's try rehab instead. So I would be expecting any kind of report in the next week and not to be surprised. And I don't want, I think the fan base not to be like, well, somebody who's going to get surgery, now he's not. What's going on? Or, I think it's just, there's so many possibilities with these injuries. So everything's kind of in play.
Okay, awesome. Some great questions coming in. James Cho wants to know, can a freak UCL tear a la Purdy look like a pitcher UCL injury?
Yeah, no, that's another great question. I think with football players, just because, especially with quarterbacks, like you're pretty much only going to get the freak injuries for the most part. Like you just need someone to basically hit the arm and then it's kind of like, boom, everything was good. Then it breaks, because quarterbacks just don't throw as much as pitchers. They're not throwing as hard. They're not doing those breaking pitches. So usually with pitchers, it's something that's been building up for a long period of time, even though there's like one throw that usually like is the final thing that kind of breaks the straw on the camel's back. Usually that's been developing for a period of time. The quarterback, it's like most of them don't have pain beforehand. So it's definitely rare. Like I was telling someone, earlier this week, like if Purdy would have gotten hit in 2 seconds later, it would have been fine. It just been a regular blow that a quarterback gets to his arm. It was just kind of like everything lined up in his throwing motion, where he got hit, when he was releasing, for this to happen. Yeah.
So a freak injury, huh? So there is something to the idea that there is someone with a voodoo doll somewhere. There is someone that is doing some sort of voodoo on the 49ers to have this happen. And it's not necessarily something that the coach himself could do. I like that. That's real good. All right. Ruben's question is great because there you did mention that there were 2 or 3 throws in this game. I think a lot of people want to know, like Ruben's asking, there's been some talk about Purdy going back into the game after the injury and could he have done more damage? I think this is a great question. How good is the ortho stress test or RI or RO report performed on the sideline? So like you see him throw the ball 2-3 yards, right? And then you think, well, is he hurting himself further, or is that something where it's just because you see him throwing on the sideline?
Yeah.
Warming up, right? Like, my thing is always like, when there's a pitch count for pitchers, they say, well, he threw this many pitches. Well, what happened to the warm-up pitches? Like, you just does the arm just not count them? So right. Was there any sort of damage that could have been done even with those short passes on the sideline and in the game?
I think typically not. I think generally with something like this, I mean, when you're examining him on the sideline, you have a sense that, look, we think you might have damaged your UCL. You might have, you kind of in there saying he might have had some nerve symptoms. Maybe your nerve's a little banged up. Typically just because of the force from throwing, I think it was more of an issue of can he tolerate it in terms of like being effective? The degree of damage, it would have to be a lot of repetitive throwing once it's been torn to hurt it more. I think where you get more concerned is if someone would have like landed on his arm or, something other kind of injury happened. But for that to happen with him just handing off, I think it's pretty low. And that's really then kind of like a discussion between the medical staff and the coach and the player. Like, look, these are the risks. If it's already torn, maybe you're not going to make it that much worse. So I think the risk of him making it worse was probably there, but not something where it's like, oh, geez, what were they doing? It's clearly like, something you discuss with him. And I think the chance of it actually getting worse is probably pretty minimal. Yeah.
Okay. So RI and RO meant ruled in, ruled out.
Ruled out. Exactly.
Yeah. So that's exactly what he was talking about at this point. I think Terradome has a question here too. Is it best for performance and or longevity for Purdy to have the Tommy John surgery? What's your thought on that?
Yeah, no, it's great. I think a lot of it's based on what they see inside there. Like I think if everything is good quality and they're able to kind of repair everything back, that's the best thing for him. Anytime you're taking something new or putting it in, the body needs to heal it. The elbow can kind of respond a little abnormally. So if you've got good quality tissue, it's better to repair it than to do the reconstruction. That being said, if there's any question in terms of the quality of that tissue or how his elbow responds to it, hindsight's always 20/20. But I think for a quarterback, just given the stress, absolutely, I think it's better to do a repair. In a pitcher, different story. I think most pitchers would err for the full-on Tommy John surgery because even with the repair, you're going to be stressing it so much more that pitchers just need the bigger surgery. But quarterback, I think it's a little bit safer to go with the less invasive procedure. Yeah.
Nice. Okay, so to put a wrap on all this, right? Kyle Shanahan had his exit interview. He seems pretty steadfast in 6 months. When asked about Jimmy Garoppolo, he really kind of closed the door, even though, Doc, I got to tell you, I am not taking anything. I'm not taking anything. Tom Brady, I don't care. You retired. I still don't believe it. I'm not going to believe it until someone else is under center and he's not playing in week 1.
Right.
But do you really believe that this is something where, based on him looking for options, based on the way that Kyle Shanahan and John Lynch spoke, based on what you know about the injury, just your estimated guess? This isn't something like, again, that you don't know. You haven't been privy to any of the information directly. Training camp, what do you think? Is it how feasible? What percentage would you say?
I would say based on everything that's reported and what's been said by the team, I'd probably say there's, in my eyes, I would guess probably like a 90-95% chance Purdy's out there.
Great.
And I think the thing that I think is the least predictable is, we can repair stuff. It's just you can't predict how he's going to respond to the injury. And that's the tough thing. We don't know how mentally, it's easy to say we know what happens when you have an ACL or things like that. But, will he be a little bit hesitant when he's throwing? How does it impact his throw if he feels a little soreness? I think that's the hard thing to know. But I think that, I think there's a good likelihood he'll be out just based on what we know about everything that's being reported. Yeah.
I love it. That's great. That's what some good news finally. Here we go. We don't got Vic Fangio. We don't got this guy. We don't got this guy now. It's like, what do we have good to talk about now at this point? Evoke says, does a repair with additional internal band fix feel different after healing, and how invasive is that procedure? Man, some really good questions.
Yeah, no, that's great. So what he's referring to is there's something called an internal brace. So you hear that when they talk about the Nick Mullins surgery, and what that basically is it's almost like a piece of tape, a stronger tape, almost like a little rope, where you put it in with the ligament to basically get it a little bit stronger. So the thought is you repair this tissue, maybe there's a little bit of weakness in it, so you put this in there as well too to strengthen it. And really what that does is help to kind of support the elbow so you can start rehabbing a lot more quickly. So it has the same invasiveness as a repair. You're basically doing it at the same time, but it kind of gives you a little bit extra stability both to your own tissue as well as allows you to rehab a little bit quicker. So most repairs now will have that added in, so you can do things a little bit more quickly. So same invasiveness, but it definitely, that's something that's kind of changed a lot of ways we do surgery, is that we have this additional material we can put in that helps speed up the process and kind of takes a little bit of load off the repair.
Awesome. 20 minutes in, almost 150 people in here. Make sure you like this video, subscribe to the channel, hit that notification bell for when we go live. Make sure you're following Dr. Nirav Pandya on Twitter. All right, Doc, let's pivot from Brock Purdy. Let's pivot to the quarterback who is about to be cleared. I can't remember if it was like 3 or 4 weeks or something like that, which is right there. And Kyle talked about phase 1, which is mini camp, then it's OTAs, then it's training camp. Trey Lance, what do you think about the timetable that they're setting and how he looks? I mean, obviously from videos that you see, he's out of the boot, those type of things. With the type of injury, does this timetable line up with what's consistent with that injury?
Yeah, I think so. I mean, I think that anytime anyone breaks a bone, the number one thing you're first worried about is the bone healed. Now, we have to assume that if they took out what was in there to make the bone heal, they wouldn't take it out unless the bone was healed. So I think we can at least, say like, hey, that's good news. Now everyone's saying like, oh, this is bad, he got it out. I look at it this way, is that when you fix a fracture, this plates or screws or whatever you put in, they can potentially irritate you at any point. Whenever we do surgery, we always say that. Now, it's better for it to irritate you early on, because then you can deal with it now. And now he's got 4 or 5 months to train, as opposed to suddenly it's week 1, week 2, training camp, or the beginning of the season. It's like, oh, this plate and screws is bothering me. It's impacting my performance. So this way he gets it taken care of. Now he's able to just fully rehab, and you're not worried about that causing irritation. We're assuming his ligament's fine as well too. So absolutely, I think there's no reason why, barring something bizarre happening with his ankle, he won't be ready. Typically, most people, when you get that kind of stuff taken out, you pretty much clear them to go back to things like literally within 4 to 6 weeks after they get it done, which sounds like the timetable for Trey Lance. So I think he's going to have a great offseason of training, getting ready, not having to deal with anything with this ankle. So I think he's going to be on path for absolutely being ready for training camp.
Gammon Brown, thank you for the donation. He says recovery time for a broken heart after the game. Doc, I don't know. I mean, Doc, you're very knowledgeable with broken bones and tears. This one is so much more loaded, I think.
It's a tough one. It varies on the quality of the heart. Let's put it that way. How many years you've been a 49ers fan? It's tough. It's tough. I think we're getting used to making it to the championship game and not being there. So it's every time you get there, it makes it a little bit tougher. Yeah.
Always the bridesmaid, never the bride, right? It seems like this at that point. All right, Doc. So you talked about a little bit about training camp. So it sounds like Trey Lance is going to have a bit of a leg up, right? Like in terms of being the guy, quarterback 1, right? Like taking all the reps, while Brock Purdy, who you said is going to be 95% chance for him to be ready at training camp, and his arm will be back to full strength, especially because there's going to be a 3-month period where he builds his arm back up and he should be fine. So in terms of that lines up. This makes for an interesting conundrum, right? Like with how things are going to play out, right? So if Brock Purdy goes along and everything works out fine and Trey Lance is fine and everything's there, right? Kyle Shanahan kind of said, hey, I'm good with Trey and Brock. I think that's a fantastic quarterback room, especially when you think about talent and how much the money would cost to keep both of them, regardless of whoever it is that starts. But they would have to bring somebody else in, right? Like they would have to bring in another quarterback. So what would worry you about this timetable, and what could possibly pop up that would either land somebody on IR or the PUP list or something like that?
Yeah, I think for Trey, number one is if you kind of saw Dak Prescott kind of had multiple surgeries on his ankle, kind of similar thing. I think with him, I think that's probably a less likelihood unless there's something we're not hearing from the 49ers. But I think with Trey, what makes him great is his mobility. And it's always hard to say how confident someone's going to be, especially if they've broken their ankle and that kind of play, in terms of avoiding contact, trying to make that big play. Is that going to impact his ability to perform? And I think that's unknown with him. And we've seen a lot of people have ankle fractures. It's usually season 2 when they get that confidence back and are willing to make those quick moves, or are less willing to kind of like avoid a tackle and then throw as opposed to kind of taking the sack. So I think that's one for him. I think for Purdy, it's going to be, is this going to at all impact accuracy or his quick release? I mean, that's what makes Purdy great. I mean, he makes quick decisions. He's reading, there's not as much time in the pocket, and is his elbow going to impact that at all? So those would be the 2 main things I would think of from a performance standpoint. But in general, I think is how would soreness impact them as well too? So is Trey going to be limited because he hasn't really loaded or played football for a long period of time? And is he going to have more soreness? Is that going to impact his ability to play? Or same thing with Brock. Is he not going to be able to throw as much because, he's looking great, but then suddenly after 30 throws, he's got to kind of rest a little bit from fatigue. So there are a couple different physical things you may see, but I think a lot of it probably will be more mental. How do they respond to each of their respective injuries?
Awesome. 25 minutes in, Doc. I'm getting a lot of good information here. You're actually making me feel a lot better. Again, Vic Fangio's gone. Who's the defensive coordinator? D'Amico Ryans has his head coach press conference today. It's been a rough few days for all of us, right?
Yeah, absolutely.
So I kind of told you that this was going to be the last question I was going to get to you. We have 140 people in here, 25 minutes in. Make sure you like this video, subscribe to the channel, hit that notification bell for when we go live. Doc, thoughts on how this is going to play out going into training camp? Again, I always implore people to remain fluid, because obviously all of this stuff is going to be fluid, especially when you consider the injury timetables. February 2nd, what's your beat on this right now at this point in terms of who do you feel jumps out to a lead? What do you think? How does this play out?
I think, where I look at it, assuming everything physically goes well, Brock Purdy's played more football than Trey Lance. I think at the end of the day, he played in high stakes football. He played a lot. He's got the 4 years of college, and he did this, and he's essentially not missing anything. He's missing this season. He wouldn't be missing the offseason. So I think Trey's got a big hill to climb because he just hasn't played a lot of live football. And Brock's going to come in. Yes, he'll potentially have surgery done, but he's going to have a lot of that experience. The receivers have meshed with him. He has rapport with them. So I think Purdy has the leg up, going into training camp. But Trey has opportunity, so I think that's going to be it'll be interesting to see how it all plays out.
Absolutely. And thank you for the donation, Tony. Thank you, Dr. Pandya. Thank you, Jason. Hey, don't thank me. I'm just the guy asking questions. They're taking your questions. I'm not giving you any info. Doc, I appreciate you. I know that you're traveling. I know that it's cold out there. I really appreciate you giving some time for me. Let everybody know where they can follow you for more information. You're really good on Twitter for your quick hitting videos on the things that you see. Just a reminder, Doc has not been privy to anybody's information. Nope. This is just his medical opinion based on the data that is there to support it, the injury itself, and what he believes going forward. So, Doc, let everybody know where to follow you.
Yeah, absolutely. No, thanks for that, Jason. I'm at Dr. Nirav Pandya. And like Jason said, I'm not taking care of any of these athletes. I'm not looking at their exams. I'm just using my knowledge based on what I see in my own practice, the data, and, giving opinions, explaining stuff for people. That's all. Not speculating, just explaining. That's the way I like to say it. Yeah.
Yeah, so make sure that you're following Doc on Twitter. Doc, real quick, I know it's a football program, and for anybody asking, yes, this is a 49ers fan that you're talking to. Are the Warriors going to turn it up? Am I going to start to because I have to do something now. I'm going to be covering the Super Bowl this week. Cool, whatever. I'll be able to bide my time and before the combine, before I head out and do all that stuff. I need to start watching basketball and maybe putting some money on the Warriors. What am I doing here at this point? Just watching.
You get 2 games and you're like, wow, this is championship caliber basketball, and then they just suddenly give up. So I think that the potential is there for them to have a championship run. The question is, can they all turn it on at the same time and not get injured? And if they're motivated and they do it, I don't think anyone can stop them. But then you see them lose by 30, and you're like, what's going on? So it's all about the motivation. So.
All right, Gamma has one more question, and I'll get you out of here. As a primary care physician, how do you mentally assist patients with that aspect of recovery and how it differs from physical? Thank you for your time.
No, absolutely. That's a great question. And I think we concentrate on return to play timelines and how we do the surgeries and things like that. What doesn't get talked about is the mental aspect of it afterwards. These people have got this huge injury, their livelihood depends on it, and they're worried about, are they going to get injured again? Am I going to lose my spot? And I think a lot of the performance for people after injuries, we talk about what's wrong with this person's knee or what's wrong with what they got done. A lot of it's mental. We don't talk about it enough. So more and more, when I'm seeing patients, or I'm sure a lot of team docs are seeing patients afterwards, we're not concentrating on the physical part. We're like, here are the things you need to do mentally to get yourself ready. It's okay to feel like you're not there yet. It's okay to relive the injury in your head. We saw that with Klay Thompson, using a basketball example. It took a while for him to mentally get back. He spoke about that. So absolutely. I think our goal as people transition back into sports is not necessarily telling them about how to play, but how to mentally get prepared. And I think that's even more important when we get to the end of the road. It's absolutely important. Yeah.
I think that that's really important what you said about, letting people know that it's okay, because, if you do push yourself and you don't feel like it's okay, it is an aspect of this is mental, right? There's guys that have these gut wrenching injuries and they're able to overcome it over and over. Some guys have different, ways that they can get back from it. And I do think that it's important that you say that. That's something I never think of. Remember, we're fans, right? So we're sitting there like, how fast can you help this team so you can help me have joy and win? We never really think about that, right? And that's why I've gotten more sympathetic to it, especially considering what's happened to Jimmy Garoppolo year after year. Like, regardless of whatever you feel about how Jimmy Garoppolo's performed, whatever, you still have to be gut-wrenched for the guy, like, over and over having to come back. That's why Andrew Luck gave up. Like, I think that's a prime example. Andrew Luck couldn't do it over and over again, and we were kind of robbed of a generational talent, and I think a lot of that goes by the wayside. So thank you for that answer. So, look, Doc, 30 minutes. I'm going to get you out of here. I said it was going to be 15, 20. I apologize. 135 people in here. Make sure you like this video, subscribe to the channel, hit that notification bell, follow Doc on Twitter for all of your injury needs about the Warriors, 49ers, or just anybody that's out there that he's watching. So for Doc, for Jason, thank you guys for tuning in. Go Niners, and guys, take it easy on each other. It's only like day 4 of the offseason. There's a lot more to do. So see you later.
All right, take care.
Welcome, everybody. Let's go Niners. My name is Jason Aponte.